One of the most damaging intimacy mistakes after 60 often begins with 5 innocent words. It is probably just age. A little pain is dismissed. A change in performance is hidden. A new medication is never questioned. An unusual symptom is quietly explained away. And before long, two people who still love each other begin to believe something has disappeared between them. But after 60, a change in intimacy can come from many places. Hormonal changes, dryness, arthritis, stress, diabetes, blood vessel or nerve problems. A medication side effect, or simply a body that needs more time and a different approach than it did years ago. The danger is not intimacy itself. The danger is ignoring what your body is trying to tell you, then allowing fear or embarrassment to make the decisions. In this video, we are going through 7 mistakes that can affect comfort, confidence, relationships, and sometimes physical health after 60. Mistake number 5 involves products advertised as natural that may contain hidden prescription ingredients. Mistake number 3 is a change many people hide from their doctor, even though it can sometimes be connected to another health issue. And the number 1 mistake is the reason the other 6 can continue for months without being addressed. Before we begin, let me introduce Helen and Arthur. They are fictional, but their story combines situations that healthcare organizations repeatedly warn older adults about. Helen is 67, Arthur is 70. They have been married for nearly 4 decades. They still laugh at the same old jokes. They still drink tea together every evening. Arthur still reaches for Helen's hand when they cross a busy street. But one night, something changes. Helen feels discomfort and notices a small amount of spotting afterward. Because she has been through menopause, she knows it is unusual. But she tells herself it was probably friction. Arthur notices she has become tense. He assumes she is no longer interested. At the same time, he has been experiencing changes in his erections. He assumes Helen will think he is no longer attracted to her. So Helen hides her discomfort. Arthur hides his anxiety. Both believe they are protecting the other. That is where their real problem begins. The 7th mistake is treating pain, bleeding, or irritation as the unavoidable price of getting older. Some physical changes are common after menopause. Lower estrogen levels can contribute to vaginal dryness, thinner tissue, burning, irritation, and pain during intimacy. Natural lubrication may also take longer than it once did. Common does not mean imaginary. And common does not mean you must tolerate it in silence. The first rule is simple. Pain is information, not a test of commitment. If something hurts, pause. Do not push through it to avoid disappointing someone. Do not assume your body simply needs to get used to it. And do not keep repeating the same activity in the same way while hoping the discomfort will disappear. For many people, a water-based or silicone-based lubricant can reduce friction during intimacy. A vaginal moisturizer is different. It is used regularly to help with ongoing dryness rather than only during sexual activity. Oil-based products are not always a good choice. They may irritate some people and they can make latex condoms less effective. But self-care has a limit. Persistent pain, sores, unusual discharge, urinary symptoms, or bleeding after menopause should be discussed with a healthcare professional. Postmenopausal bleeding can have more than one cause, including delicate tissue that bleeds from friction. But it should still be evaluated rather than diagnosed at home. Notice the balance here. You do not need to panic. You also should not dismiss it. Helen's mistake was not that she experienced discomfort. Her mistake was deciding without asking anyone that the symptom was unimportant. She also feared that saying stop would make Arthur feel rejected. So she continued even though her body was telling her to pause. A healthier sentence would have been, "I want to be close to you, but this is uncomfortable. Can we slow down and try something gentler?" That sentence does 3 things. It confirms affection, it describes the problem, and it asks for cooperation, no accusation, no shame, no guessing. But Helen and Arthur were also making the sixth mistake, trying to make an older body follow a younger timetable. Many couples unconsciously compare the present with the past. They remember how quickly their bodies once responded, how spontaneous everything felt, and how little planning seemed necessary. Then they treat any difference as evidence that something is wrong. But aging can change timing without removing desire. Some people need more time to feel relaxed and physically responsive. Arthritis, back pain, fatigue, poor sleep, surgery, chronic illness, anxiety, and medications can all affect comfort and sexual function. The body may still want closeness while needing a slower route to get there. Arthur had started rushing because he worried that if they paused, he might lose his erection. Helen wanted to slow down because rushing increased her discomfort. They were moving in opposite directions for exactly the same reason: fear. The more Arthur monitored his body, the more anxious he became. The more anxious he became, the harder it was to respond naturally. The more Helen braced for discomfort, the less relaxed she felt. Now neither person was experiencing the moment. They were both grading it. The solution is not more pressure. It is removing the clock. Choose a time when neither person is exhausted. Allow more time for affection and relaxation. For arthritis or chronic pain, changing position, using supportive pillows, taking a warm bath, or choosing the time of day when pain is lowest may help. And remember this distinction. Slower does not mean weaker. Different does not mean broken. The goal is not to force your present body to imitate your younger body. The goal is to understand what your present body needs. Helen and Arthur could have prevented weeks of confusion with one question. What would make this feel more comfortable for both of us tonight? But instead of asking that question, Arthur made mistake number 5. He searched for a private solution online. He found a small product advertised for sexual enhancement. The page used reassuring words: herbal, natural, fast, discreet. That language made the product feel safer than a conversation with his doctor. This is where embarrassment can become a medication risk. The United States Food and Drug Administration has repeatedly warned consumers about sexual enhancement products found to contain hidden prescription ingredients, including sildenafil or tadalafil, even when those ingredients were not listed on the label. Those ingredients are used in legitimate prescription medications for erectile dysfunction. Under medical supervision, those medications can be appropriate for many people. The danger is the hidden dose, the unknown combination, and the lack of a medical review. Sildenafil and tadalafil can interact with nitrate medications such as nitroglycerin and may cause blood pressure to fall to dangerous levels. That is why natural is not the same as interaction-free. Sold online is not the same as medically appropriate, and no prescription needed is not proof that a product is safe for your heart, blood pressure, or other medications. Do not borrow another person's erectile dysfunction medicine. Do not combine enhancement products because the first one did not seem to work. And do not stop a prescribed medication on your own because you suspect it is affecting desire or performance. Some antidepressants, blood pressure medicines, antihistamines, sedatives, pain medicines, and other drugs can affect sexual function. But suddenly stopping a necessary medicine may create a much greater risk. The safer move is to bring your full medication and supplement list to a doctor or pharmacist and ask, could any of these be contributing to this change, and what are the safe options? Arthur almost clicked the purchase button. Then he noticed his bottle of heart medication on the table beside him. For the first time, he wondered whether the private solution might create a public emergency. He closed the page. That single decision protected him from taking an unreviewed product with unknown ingredients. But Helen and Arthur were still avoiding another conversation, and it leads to mistake number 4. Assuming age, trust, or menopause removes the need to think about sexually transmitted infections. For a couple who has been mutually monogamous for decades, their personal risk may be low. But many people over 60 begin new relationships after divorce, separation, or the death of a partner. Pregnancy may no longer be the concern it once was. That can make protection feel unnecessary, but age does not prevent sexually transmitted infections. Many STIs cause no symptoms or only mild symptoms. A person can feel healthy and still have an infection. Testing needs depend on sexual history, current practices, symptoms, and partners. That is a conversation for a healthcare professional, not a decision based only on appearance. With a new or non-exclusive partner, discuss testing and barrier protection before deciding to stop using it. A respectful sentence is, "I care about both of us, so I would like us to talk about testing before we change how we protect ourselves." That is not distrust, it is shared responsibility. Trust tells you what you believe about a person's intentions. Testing gives you health information. You need the first for a relationship. Sometimes you need the second for safety. Helen and Arthur were not facing a new partner situation, but this mistake mattered to someone close to them. Helen's widowed friend had recently started dating again. She believed condoms were only about pregnancy and felt embarrassed asking a new partner about testing. Helen realized something uncomfortable. She had encouraged her friend to just trust her instincts, but had never mentioned sexual health. That evening she called her friend and said, "You are never too old to protect your health." It was the advice Helen herself needed to hear in a different form. Because the third mistake is hiding persistent physical changes from a doctor. Occasional changes can happen. Stress, fatigue, alcohol, pain, anxiety, or a difficult day can affect sexual response. But a persistent pattern deserves attention. Erectile dysfunction is not simply a routine part of aging. It can be associated with conditions affecting blood vessels, nerves, or hormones. Diabetes, heart and blood vessel disease, high blood pressure, kidney disease, some medications, anxiety, depression, and other factors can contribute. That does not mean every episode signals a serious disease. It means repeated changes should not be automatically blamed on age. The same principle applies to ongoing pain, new irritation, unusual discharge, sores, urinary symptoms, or continuing changes after surgery or illness. A symptom in the bedroom still belongs in your medical history. Arthur had attended 2 routine appointments without mentioning what was happening. He discussed his knee. He renewed a prescription. He talked about sleep. Then he left with the question he most needed answered, still trapped in his throat. Why? Because saying erection to a doctor felt more embarrassing than searching the internet alone. But doctors cannot evaluate a change they never hear about. You do not need a dramatic confession. You need one clear sentence. I have noticed a persistent change in my sexual function. Could it be connected to my health or medications? Write it on a note if saying it aloud feels difficult. Send it through a patient portal before the appointment. Bring your partner if that makes the conversation easier. The point is to stop guessing. And there is one more safety line worth remembering. If sexual activity or any physical exertion brings new chest pain, fainting, or severe shortness of breath, stop and seek urgent medical help. For people with stable heart disease, sexual activity is often safe, but severe or unstable symptoms require medical assessment. Arthur finally raised the issue at his next appointment. His doctor did not laugh. He did not look shocked. He asked ordinary medical questions about timing, medications, blood pressure, diabetes risk, stress, and other symptoms. The conversation Arthur had feared for months took only a few minutes to begin, and it gave him something the internet had not given him. A plan based on his actual health, but a medical plan alone could not fix what was happening between him and Helen. They were making mistake number 2. Turning intimacy into a performance test. Many people were taught that intimacy has one correct sequence and one successful ending. If an erection changes, the evening has failed. If penetration is uncomfortable, intimacy is impossible. If orgasm does not happen, something is wrong. This turns closeness into an examination, and no one relaxes while waiting for a grade. Intimacy can include affection, touch, kissing, massage, conversation, cuddling, emotional closeness, and sexual activity. It can have a physical component, an emotional component, or both. That is not lowering the standard, it is expanding the definition. A performance-based experience asks, did my body behave correctly? A connection-based experience asks, did we both feel safe, wanted, and close? The first question creates pressure. The second creates options. Performance pressure can also feed the other mistakes in this video. It can make someone rush. It can make someone push through pain. It can make someone hide a symptom. It can make someone buy an unverified product because they believe they must repair themselves immediately. So try removing the required ending. Agree that affection does not have to lead anywhere specific. Let both people say what feels good, what feels uncomfortable, and what they are not ready for. Success is not proving that nothing has changed. Success is responding well to the changes that have happened. Helen and Arthur tried something that felt almost too simple. They agreed to spend an evening being close without promising any particular outcome. At first, the silence felt awkward. Then Helen said, "I have been afraid that slowing down would disappoint you." Arthur answered, "I have been afraid that slowing down would expose me." That was the moment their real problem became visible. Neither person had lost interest. Neither person had stopped caring. They had both been performing confidence while privately feeling afraid. Which brings us to the number one mistake: using silence to protect each other. This mistake is number one not because silence directly causes every physical problem. It is number one because silence allows the other six to continue. Silence lets pain repeat. Silence lets medication interactions go unchecked. Silence lets persistent symptoms remain hidden from doctors. Silence turns changes in the body into stories about rejection. And silence allows two caring people to make decisions using incomplete information. Helen had believed, if I mention pain, Arthur will think I do not want him. Arthur had believed, if I mention my erection changes, Helen will think I no longer desire her. Both beliefs felt protective. Both were wrong. The most important intimacy skill after 60 is translation. Translate what your body is experiencing into words your partner can understand. Do not assume a change in desire means a loss of love. Do not assume an erection change means a loss of attraction. Do not assume needing lubricant means desire has disappeared. Do not assume that affection is automatic permission for more. Consent remains clear, mutual, and active at every age. And do not wait until a painful or emotional moment to begin the conversation. Talk when you are both calm, fully dressed, and not expecting anything to happen. Start with, I miss feeling relaxed and close to you. Can we talk about what has changed and what would help now? Then ask 3 questions. What do you still enjoy? What has become uncomfortable or stressful? What would help you feel safer and more connected? Listen without immediately defending yourself. Your partner's changing need is not automatically criticism. It is information. Helen told Arthur about the discomfort and the spotting. Arthur told Helen about the persistent changes he had been hiding. Helen arranged a medical evaluation. Arthur reviewed his health, medicines, and treatment options with his doctor. Neither tried to diagnose the other. Neither stopped medication without guidance. Neither treated one difficult evening as proof that their relationship was ending. And something surprising happened. The honesty did not make them feel older. It made them feel like partners again. Their bodies had changed. Their timing had changed. Their definition of intimacy had changed. But closeness had not disappeared. It had been buried under assumptions. So remember the 7 mistakes. Do not dismiss pain, irritation, or postmenopausal bleeding as just age. Do not rush a body that may need more time, comfort, and preparation. Do not use unverified enhancement products or change medications without checking with a qualified professional. Do not assume age or trust makes STI conversations unnecessary in a new or non-exclusive relationship. Do not hide persistent physical changes from your healthcare provider. Do not turn intimacy into a pass or fail performance test. And most importantly, do not use silence to protect someone who needs accurate information in order to understand you. This video is for general education. It cannot diagnose a medical condition or replace care from a qualified healthcare professional. Seek medical advice for persistent pain, postmenopausal bleeding, sores, unusual discharge, urinary symptoms, continuing erectile difficulty, medication concerns, or any other change that worries you. And seek urgent help for severe or new symptoms such as chest pain, fainting, or major shortness of breath. There is one last detail in Arthur's story. When he reviewed his medications, he learned that a medicine can sometimes contribute to sexual changes without being a medicine he should suddenly stop. That distinction matters, because one of the most dangerous reactions to an intimacy problem is quietly abandoning a heart, blood pressure, or mental health prescription without a safe replacement plan. In the next video, we will look at the common types of medications that can affect desire, comfort, and sexual response after 60. The questions to ask your doctor, and the one thing you should never do on your own. Until then, remember this. A changing body is not a failed body. A difficult conversation is not a broken relationship, and asking for help is not the end of intimacy. For many couples, it is how intimacy begins again.